Good morning, everyone. My name is Larry Shulman. I'm the co-chair of this workshop, Innovation in Electronic Health Records for Oncology Care, Research, and Surveillance. Welcome back. As those of you who were with us yesterday know, this is day 2. Yesterday, we heard 4 sessions that went over a variety of innovations in electronic health records and opportunities. Today, we will have 2 sessions to conclude the workshop. The first session will be on the roles of federal agencies to advance progress in EHRs. And that session will be chaired by Dr. Robert Carlson, the CEO of the National Comprehensive Cancer Network, and Nicole Dowling from the Centers for Disease Control and Prevention. After that, we will then have a panel discussion, which will be made up of the moderators for the first 5 sessions, where we will discuss the takeaway messages from those 5 sessions and suggest opportunities for advancement in EHRs going forward. With that, I'd like to introduce the moderators for session number 5, Dr. Carlson and Dr. Dowling. I'll hand it over to you. Thank you very much.
Good morning, and thank you, Larry, for the nice introduction. Welcome, everyone, to our session focused on the roles of federal agencies to advance progress in EHRs. As Larry said, I'm Nicole Dowling. I am the Associate Director for Science in the Division of Cancer Prevention and Control at the Centers for Disease Control and Prevention. I will be co-moderating this session with Dr. Robert Carlson, who is the Chief Executive Officer of the National Comprehensive Cancer Network. The objective of this session this morning is to explore current initiatives and collaborations among federal agencies to conceptualize and implement innovations in EHRs, and to discuss potential policy incentives to improve EHRs for their use in cancer care, research, and surveillance. We have speakers representing a number of different agencies who you will hear from this morning and who will guide us through our discussion today. We will start off with Thuy Sim. Dr. Sim is Assistant Director of Transformative Medicine and Health Innovation in the Office of Science and Technology Policy at the White House. She is also the Senior Medical Advisor and Lead of Infectious Diseases in the Defense Health Agency at the Department of Defense. We will then hear from Lynn Penberthy. Dr. Penberthy is the Associate Director for the Surveillance Research Program in the Division of Cancer Control and Population Sciences at the National Cancer Institute. Next up, we will hear from Lisa Richardson. Dr. Richardson, my colleague, is the Director of the Division of Cancer Prevention and Control at the Centers for Disease Control and Prevention. Following Dr. Richardson is Paul Klutz. Dr. Klutz is the Deputy Director of the Oncology Center of Excellence in the U.S. Food and Drug Administration. We will then hear from Avinash Shanbhag. Mr. Shanbhag is the Executive Director in the Office of Technology at the Office of the National Coordinator for Health Information Technology. Our final speaker in the session will be Laura Strawbridge. Ms. Strawbridge is Director in the Division of Ambulatory Payment Models at the Center for Medicare and Medicaid Innovation at the Centers for Medicare and Medicaid Services. For more information about our esteemed speakers, I encourage you to take a look at their bios, which are available in the briefing book posted on the workshop website. Before we launch into our presentations, I want to quickly review the session format. All of our speakers' presentations in this session have been pre-recorded and will play consecutively. After the last presentation, we will begin a live panel discussion. We strongly encourage your involvement in this workshop this morning. Please make use of the chat box on our website if you would like to ask questions or enter any comments. Thank you, and without further ado, we will now begin the presentations.